You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, a new trend in plastic surgery, which is addressing the whole person. Comprehensive facial rejuvenation. With us, we have an expert on the topic. He is the go-to person here in San Diego for this, Dr. Amir Karam. Dr. Karam, welcome to the program.
Thank you, Randy. I appreciate it.
Now, people need to know this is a real interview. I'm not trying to side with you, but I have asked you to come on this show for the last probably 5 or 7 years. So thanks for coming on the program.
Thank you. Thank you for inviting me.
You call it comprehensive rejuvenation. And I don't want to put words in your mouth, but the way you're practicing facial plastic surgery today is different than you did just 7 years ago. Tell me about that.
Okay, so basically what it comes down to is, when I was training, what I saw most of my professors in the community do was basically you had surgeons doing facelifts and neck lifts and eyelid surgeries. Then you had dermatologists doing fillers and skincare. But really, the same patient could go to 2 different offices and get totally 2 different types of consultations. One would come out with surgical recommendations, and the other one would come out with non-surgical. But in reality, both of them were right. Both groups were right, but they were treating different aspects of the aging face. And one of the things that I recognized very early on in my career was that that the face ages in a very systematic and predictable way. You've got changes that happen to the skin with discoloration, fine lines and wrinkles, things like that, thinning of the skin. Then you've got changes that happen to the fullness of the face. We lose fat in the face and the face starts to get deflated and more tired appearing. Okay. And then there's changes that happen to the elasticity of the face, and the position of the soft tissue start to change. You start to see the cheeks coming down and forming jowls. You start to see the neck getting heavier and forming this kind of a turkey waddle or heaviness in the neck. Eyelids start to sag, brows start to sag. So at the end of the day, if you're truly trying to restore somebody back to where they used to be, which is at the end of the, ultimately what patients are coming in to asking for is they say, you know what, I no longer look like myself. I feel the same. I still feel as young and as vibrant and as youthful as I always have. But when I look in the mirror, I see a photo of myself, I don't hardly recognize that person anymore. And that's
what they tell you.
That's 99% of the time what I hear from my patients. And because a lot of people think this, you go into plastic surgery because of vanity issues but it's not. It's because there's a disharmony between the way you look and the way you feel. And a lot of patients who recognize that there's a way to solve that problem, they come in and seek my help or other surgeons in that way. But basically what I've recognized is the meaning of a natural restoration is that you put everything back into its usual spot where things used to be, basically, is what you're looking at. Okay. So if for example, if you have a patient who comes in and say they're in their mid 50s and they have all the things we just talked about happening, and all you do is you just lift the jawline and neck area, and you leave the eyes the same, you leave the volume the same, that person looks a little doesn't look right. It doesn't have that odd. Yeah.
So a thin neck, tight neck, and the upper face is older than the lower face.
Exactly. Then that right there signals to everyone in
Is that going on? Is there a lot of that going on?
There's a lot of that, of course. Because what happens is patients sometimes they'll go in and they'll say, you know what, I just want a facelift. And for them, they don't recognize that all these other things that are happening. So when they go in and ask for a facelift, the surgeon gives them a facelift without addressing the other aspects.
Which is what? So a facelift would be the lower part of the face?
The lower part of the face, exactly. Okay. And then so what ends up happening is the person ends up having a little bit of a disharmony, and you can see that from a mile away. You can tell that person.
But doesn't every surgeon know what you're telling me?
You would think but here's the reality.
Why aren't they doing it?
Well, I think part of the reality is that we all have our areas of specialty. Right? I mean, if I was doing, say, for example, breast and body work 9 out of my 10 surgeries a week, then it would be hard for me to focus on the same level in terms of not only recognizing, but even having the desire to treat in this particular.
Because all you do is face.
This is all that I do. Okay. I mean, all that I do is facial rejuvenation and rhinoplasty. So for me, it really gives me a lot of time to focus on those aspects and try to make these aspects the best they can be. But essentially what it comes down to is if every part of the face is brought up to the same level, and if it's done well, technically done well, then to the rest of the world, you don't look like you've had anything.
You don't look different.
You don't look different at all. You literally look like you used to. And as long as you look like the rest of the population, people can't tell you've had plastic surgery. The times when if you think about the times when you can tell that somebody's
I can spot it, by the way.
Yeah, you can spot it when it's not done well. And it's not brought into harmony. That's if you think about it. Whenever you think so and so had a nose job or so and so had a facelift,
or like that's good work.
Well, you won't even assume that that person had something done if it was good work.
It was good work, okay.
You won't even know that that person had work done. If it's only when things look a little out of whack that it tells us, oh, they must have had work done. And it's an interesting thing.
Does it frustrate you, by the way?
That
there's a lot of this going on?
Well, of course, because the problem is so many patients would love to get these type of things done if they knew that they could get it done in a natural way.
Because nobody wants to look done, right?
No one.
Is that the number one fear?
Everyone.
Even husbands or partners?
Oh, absolutely.
They don't want their...
And children. I mean, when we see patients for consultation, the husbands are fear-stricken because they love their wives the way they are, or vice versa. The wives love their husbands. They don't mind the fact that they're aging, but it's not necessarily for the spouse. It's for the person. It's how they feel about themselves. But they're afraid that they're going to have a procedure done and come out looking different. But once they get the procedures done and they look like they used to, and they're surprised because they'll go out to their friends and their social circles, even their family members, and no one, I mean, it's so common.
So you could take a 50-year-old and give her 5-10 years
or whatever,
off.
Maybe even a little bit more. But it just depends on how.
But they can look fantastic for
their age. They're
going to
look fantastic for their age, and they're
Okay.
going to look. And the most important aspect is they're never going to look like they've had something done, which gives them a lot of confidence being out there. Because at the end of the, when you're going out and people can tell you've had stuff done, it makes you feel a little self-conscious.
You said you've seen big transformations. That means after you do the procedures, that there's a huge boost to their self-esteem.
Oh yeah.
Their elaborate on that.
Self-image. I mean, I have patients that literally say for the last 5 years, when they get ready in the morning, they don't even look in the mirror. When they're out and about, they don't allow anyone to take a photo of them because it's such a self-consciousness to them. Because again, going back to what we talked about originally, it feels like a foreign face peering back at them. And so for those individuals, once they get things lined up for themselves, and it's a huge restoration in terms of the self-image and the confidence that they get when they're out and about. And then it's nice to see that confidence with their spouses, their coworkers, in the workplace. And there's a lot of really nice transformations that take place on small and large levels for patients.
Okay, good. And these national commercials, infomercials that we see on these low downtime facelifts.
Yeah.
Looks good. What are your thoughts?
Well, here's the thing. At the end of the day, what you have to, as a consumer, you have to recognize is that there is no one facelift or one technique that can take care of everything, perfectly. When some of these types of commercials or centers, a lot of times patients are going there because they see 2 or 3 great before and afters, and they think that they're going to get the same result if they go in.
Is it true they're not even from that doctor most of the time?
Exactly, because this is a wide,
so that is true.
There may be 30, 40 different doctors that are coming and going through these centers, and depending on which doctor you happen to have the day of your procedure, will depend on the outcome. I mean, some might be a fantastic surgeon, the other 5 might give you a lousy outcome. So it's really important that ultimately the patient picks the surgeon based on their before and afters, their qualifications.
So you have a lot of before and afters for face?
We literally have hundreds on our website.
Is that right?
Hundreds.
I should have looked at those.
Yeah.
Natural looking facelift.
Absolutely.
And what's their number one fear? Just that they don't want to look done?
I would say that's one of the for sure the most common things that people discuss.
What about men? Are more and more men coming in for?
Much more. I mean, we see 1 to 2 men a week now, where we used to see 1 or 2 per month that are coming in for basically the same things, facial rejuvenation. And for them, it comes from the same sources. Okay. They want to come do it for the same, and then a lot of them also want to do it for their occupations. They want to look, they're not necessarily saying I want to look 20 years younger, but they want to look sharp. They want to look healthy. Because the thing is, when the face ages and you get deflated and jawlines come out, the impression is that you're not as healthy. And if you're not as healthy, you're not going to be as productive. You're not going to be as you can't lean on as much, or you're not going to be the man for the job, or whatever. I mean,
people do judge. Look, I interview people for, and if somebody looks exhausted, they look tired. Yeah. It is a bit of a disadvantage.
Absolutely.
With all things being equal, like 2 twin sisters, right?
Absolutely, it's an impression.
One looks vibrant.
Yeah. And this is not a new topic. I mean, there have literally been hundreds, if not thousands, of studies on the sociology of appearance and job performance, job growth, promotions, et cetera, et cetera. So it's a very real thing, and it's not just in the U.S. It's a cross-cultural type of a phenomenon.
So when choosing a surgeon, look at their work.
Yeah,
is that
correct? Look at their work. You want to ask the questions of how many of these procedures do you do every single week? because there's a big difference between surgeons that do this once in a while versus surgeons that do this a lot. And it's not to say that the ones who do it once in a while can't do a great job. It's just that
How often do you do a facelift?
We do roughly 4 to 5, sometimes 6 per week.
Is that right? That's more than most guys do in a year. That's true.
It is. I mean, I think the national average is somewhere between 10 to 12 per year for most surgeons.
So is it like golfing? You have to stay on top of your game? I mean, do you get better? Is there a rhythm to it?
I think for sure there's a rhythm. It's just like any type of motor activity where you're doing the same type of thing, and especially if you have the same staff. We have the same team that's been with me for 5 or 6 years now. So I mean, we're on the same page all the time.
It's art, because we're out of time. But would you say it's more art?
Yep. Well,
than science?
I think it starts with technique, and then what gives it that edge is the artistic sensibility of the surgeon to be able to know how much to pull, which direction to lift, and all that kind of thing that comes down to giving that really, really nice result.
You think some guys are just not cut out for this? As far as artistic
yeah,
eye?
I think you could tell. No, I think it's like a chef, right? I mean, you can learn the recipes and try it the same, but some people are gonna produce a better dish just because they have those few little small decisions they make to transform everything. I mean, there's a big difference between that.
You think you were meant to do this?
I do feel that way because I feel like I had, I've always loved working with my hands. I had a creative side of me. I had attention to detail, all the things that I think would make a good, facial plastic surgeon. I've always had those components in me. Okay,
so what do you say to the woman, and we're gonna close out here, that doesn't like the way she's aging? Maybe she looks in the mirror, as you say, she sees her mother. What do you say to her? She's afraid, though. Where does she begin?
I think the best way to begin is, what we do in our practice is, of course, we show them plenty of before and afters. We have them see patients or even call patients and talk to patients who've had things done, and then on their face we show them literally how their face is going to look like with these different maneuvers. I mean, when you lift you do this type of maneuver and you lift the face back up, all of a sudden the person looks at themselves and they say, wow, I look like I used to, and when they look up on the viewers and they see picture after picture coming out with the same level of correction and no one looks pulled or tight or unnatural, it gives them a lot of reassurance. So it's for us, it's because we have so much experience in this and we have so many patients to show, it makes the fear aspect a lot easier. So to help the patient and their families recognize that they're in the right hands.
And we didn't even mention this, but you are the nose guy. I mean, you love nasal surgery.
I love nasal surgery.
And people need to know this. Plastic surgeons don't like. I mean, a lot of them, probably like 80% love to do them, and the rest say,
Yeah, no, it's technically it's a technically totally different type of surgery.
But you like it.
I love it. Yeah, I mean it's
because is it true you got to get it right the first time?
That's your best chance of getting a great result. Yeah, secondaries are not nearly as rewarding as the first time. If you can get it the first time right, it's almost magic.
Good. I want to thank you for coming on the show.
Thank you, Randy.
Great stuff.
I appreciate it. Thank you very much.
You've been watching The Wellness Hour, the leader in medical news and information. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.